Hi friends, welcome back to my channel. Today I want to talk about hygiene with your teeth and the importance of it to lower your GFR actually. I found an article online and I wanted to share it with you guys, and it's really short. This is from the Association of Dental and Periodontal Disease. Studies have shown that an association between periodontal disease and chronic kidney disease. Regular oral care is an important strategy for reducing your GFR. Your GFR has everything to do with your kidneys. Please look that up, talk to your doctor about it, talk to your dentist about it. Okay, so I want to show you kind of what I used to use. I used to use regular toothpaste, but over the years, from dialyzing, you don't always get every drop of your blood back into your body, and it could cause anemia. And it could cause that, when you brush your teeth, if you'll notice, you may go through a period where your teeth, it looks like your teeth are bleeding, but it's just your gums, because the regular stuff is not so good anymore to use. Okay, so what I use, and I usually get the travel size because these are less costly, is these two. Okay, these work really well. And I use a toothbrush and replace this every 30 days. And then I use one of these for brushing your teeth. And when you brush your teeth, you really want to brush them at a 45-degree angle, like I said before, for 2 to 3 minutes. And then when you do the inside of your teeth, you really want to scrub at the end and get in there. And then on the sides, not that way, but on the sides, 45-degree angle around the sides. All right. And then you want to follow up with flossing. So I'll just show you. Some people don't know. I think some people just haven't been taught how to floss. So I'm just going to give you a really quick demo on this. So you put this in your mouth. I'm going to go up and around and then down. And you should have stuff on it, but you don't want to like slam it up and down in there. You want to be as gentle as you can. Okay, front, back, all the way around, and then throw this away. Don't use this again. That's because you may have germs on this. Okay, just once use on that, and then after you're done flossing, you really want to come behind and you want to gargle with mouthwash. You want to get the kind that has as many protections. This one's 24-hour cavity protection, restores enamel, strengthens teeth, freshens breath, cleans your whole mouth, kills bad breath and bacteria, up to 99.9% of germs. You don't have to use this name brand, but you really need to make sure that it's sterilized. And another thing is going to the dentist can be very expensive, right? I found out this a couple of years ago, and I want to make sure in my notes that I share it with you, is that colleges that have dental hygienist programs within the college, where students usually practice to get their licenses or to be licensed, can and may charge a lower rate to clean your teeth or to maintain your teeth. So if you can't afford a regular dentist, find out if your colleges that are around where you live, if they have a dental hygienist program, call them up. I haven't heard of one that doesn't offer a discount because the kids are learning. And yeah, they can make mistakes, but so can a regular dentist. And get your teeth cleaned at least twice a year. But your teeth have a lot to do with your health too. So don't forget to take care of your teeth. Not brushing is you think it's enough, but it's not. You really need to brush, floss with any kind of floss, and then mouthwash. Very, very important, okay? Because if your teeth get all infected and messed up, what it does is it puts pressure on the rest of your body, okay? It's your body's going to try and fight. Now, when you floss, when you're using your floss, you guys go really easy. Okay, because you could end up not knowing it, but you'll be so sore the next day, can't figure out why, and it's because of the flossing or it could be because of the way you're brushing your teeth. Please take your time when you're brushing your teeth. Now you can either do the floss first or brush. I used to brush and then do the floss, but I've learned that if I brush and then I floss, I'm still getting things out of my teeth. So I just floss first, wash my mouth out with water, and then brush. And then come behind and do the mouthwash. One other kind of hack I want to tell you about when you brush your teeth. When you first turn on the water, you want to count to about 5 seconds. And I'll tell you why. The water has been, unless you're coming right behind somebody that's already used that water and had that water come through, the water's been sitting in the pipe for who knows how long, right? And you kind of want to count to like 5 or 6. You turn the water on, count to 5 or 6, let that water come through, and then fill your cup of water and then turn it off. But don't just turn on the faucet and put your cup underneath or your toothbrush underneath it right away. Like I said, that water has been sitting in your pipes for hours, and that's really not the kind of water that you want to keep on your mouth, in your mouth, or to wash out with. So I hope that helps you guys. Again, thank you for taking your precious time to visit my channel and to learn about how to be as healthy as you can and keep your hygiene up, not just with your body, but with your teeth. Please tell me where in the world that you guys are watching this from. Please like and subscribe, because what that does is that will put it out there, not on a dialer, but they call it an algorithm, and it'll reach out. It'll reach more patients, or it'll reach more of their caregivers to know what to do. Again, don't forget, if there is a hygiene program next to one of the colleges, call them. It's a discounted rate for your teeth. Don't let your teeth go. You don't want to have added extra pain on top of all this. So I hope that helps. Again, you guys, thank you for coming to my channel. I appreciate your time, and I will have more of these to come. And you guys have a wonderful day. Thanks for visiting my site. See you soon.